Welcome to Health HOD. I'm Dr. Priya here with you. Hope you all remember a tragic incident recently reported in Vizag where a dad and son died because of rabies after being bitten by their pet dog. So this event underscores the critical importance of knowing rabies and what are the immediate steps to be taken after a dog bite and what are the preventive measures to be taken to avoid the fatal outcomes. To know all this, we have Dr. Athiramurali with us, who is a specialist in pediatric care, to give an expert advice on this. So doctor, kindly let us know what is rabies.
Hi. Rabies, it is a very fatal viral infection caused by a virus called Lyssa virus. It is a zoonotic disease, which means that it is transmitted to humans usually by infected animals. Infected animals, their salivary secretions will be having a large amount of this virus. So when an infected animal bites a human being, what happens is that this virus, through the salivary secretion, it gets deposited in that wound. And from the wound, in that wound, there will be a lot of exposed nerve fibers or nerve endings. And through these nerve endings, this virus has an affinity for these nerves. So through these nerve endings, this virus gets transmitted upwards to our spinal cord and finally to our brain. And in the brain, it again multiplies enormously, and then again it travels down to our secretory glands, including our salivary glands, mammary glands, and even to our urine, making all these secretions infectious. That means it is capable of transmitting infection to another person, even though no human-to-human transmission has been yet recorded or reported.
What should we do immediately after a dog bite?
So in case of a dog bite, first and foremost important step we have to do is we have to thoroughly clean the wound. That is by using large amount of water and a soap, preferably a detergent soap. We have to thoroughly clean the wound. At least for 10 to 15 minutes we have to clean the wound. And after cleaning, we have to let it dry. Once it is dry, we can apply surgical spirit or povidone iodine. This will chemically inactivate the virus that must have been deposited there. This step is very important because it can decrease the chance of acquiring rabies by at least 50%. The next step would be definitely going and seeing your doctor.
What are the things we need to look at a child after a dog bite in order to avoid any mishaps?
Symptoms of rabies usually starts within 30 to 90 days of exposure. And once the symptoms start appearing, it is almost always fatal. However, it is a 100% vaccine preventable disease. That is the importance of getting your child correct time vaccine.
Will any dog bite causes rabies, or is there any specific dog species that causes it?
It is not species specific. Any species dog can acquire rabies and can become infective and transmit it to others.
Many of us don't know how to identify a rabies dog. Are there any specific symptoms to be noticed, doctor?
Rabid dogs, they can be very aggressive, trying to bite everyone, trying to lick everyone, growling always, or it can be listless. They can show paralytic features. They can show aggression in response to excessive light or sound, preferring to lie somewhere quiet and dark places. They can have excessive salivation from mouth. I can have aerophobia in later stages. That is, they have a fear of air, like difficulty in breathing air due to spasm of muscles. However, in early stages, they can be having no symptoms also.
Can a child take a vaccine for rabies to avoid this mishap, doctor?
So, rabies is a highly fatal disease with its mortality reaching almost up to 100%. So, what we can do or how can we prevent this? So, there are two kinds of situations. One is pre-exposure prophylaxis, that is prior to any dog bite. In individuals who are highly exposed to such situations, they can go for rabies vaccine. This rabies vaccine, which will provide or it will induce production of antibodies against rabies infection in our body. Now, second situation is post-exposure prophylaxis, that is after getting a dog bite or infected animal bite. So there are three steps. One is, as I already told, thorough cleaning of the wound and get surgical spirit of povidone iodine cleaning. Second step is again vaccination. Here rabies vaccine It will provide it will induce immunoglobulin production in our body against rabies infection. But definitely it will take some time, like almost 7 to 14 days it will take. So for immediate protection, third thing is we have to give either monoclonal antibodies or immunoglobulins, rabies immunoglobulins. But however, we are preferring monoclonal antibodies if that is available.
Will vaccination affect the child growth in future? I mean, is it safe without any side effects, doctor?
Rabies is a 100% vaccine preventable disease, and there is no proof of vaccine causing any negative effect on child's growth or his future.
Can any other animal bite causes rabies or only dog bite causes it?
Rabies is largely transmitted by infected dogs and cats. A small percentage has also been transmitted by wild animals like mongoose, foxes, jackals, and other animals like monkeys, horses, donkeys, etc. Domestic rodents, rabbits, they are not ordinarily known to cause rabies.
And what are the preventive measures to be taken to avoid the fatal outcomes?
Not all rabid dog exposure will require vaccines. So there are three categories. In category 1, just feeding the animal or touching the animal, or just licks on covered skin by the animal. This won't require any vaccination, just cleaning will be enough. Now category 2, here there will be nibbling of uncovered skin or minor scratches or abrasions without bleedings. This category, it will require both local cleaning as well as rabies vaccine administration. Now coming to category 3, here there will be at least one transdermal bite or scratch with bleeding, or licks on broken skin, or contamination of the mucous membrane by licks or saliva from the rabid animal. So in this category, it will require first local treatment of the wound, then immunoglobulins or monoclonal antibodies, and rabies vaccination.
So always consult healthcare professionals and ensure timely medical intervention to prevent such heartbreaking outcomes. Be safe. This is Dr. Priya signing off. Thank you.